Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Good morning, everyone. My name is Cindy, and today I will be presenting the Q&A Orders Management webinar. I will also be answering any questions that you may have for me at the end. So first, we're going to go ahead and start off with the QA Center. To get to the QA Center, you'll want to go to the home icon, Quality Assurance. So the QA Center is where all of the documents will flow once they have been signed and completed by your clinician. So you'll notice on the left-hand side, we have a location drop-down. This is for any agencies that have multiple branches. They do have the capability to select their location. You'll notice we have a date range in which it will allow you to go as far back as you may need. We have an all task filter. So if there's a specific task that you wanted to view, maybe you want to view all of your OASISes, or specific to an HHA visit, you have the capability to select that task. You'll notice we have a pending option. So this is if you would like to view all of your pending documents that are pending QA review. You also have the capability to view your return documents. Your return documents are your documents that you have returned to the clinician. You'll notice we have an Axxess Care icon. So when you select Axxess Care, any visits that have been completed by your contracted clinician, you will be able to view those documents here. Okay. You have the capability to search by patient or the medical record number. If you wanted to view a certain payer, you have the capability to do so as well. Maybe if you wanted to view all of your pending tasks for your Medicare patients, you would select Medicare. Or maybe you just want to view Aetna. You would select that payer. You'll notice to my right, you have 5 pending documents, and it gives you the breakdown down below of what documents are pending. Okay? You also have returned. As of right now, we currently have 1 order that has been returned back to my clinician. Okay. Here you'll notice that you can sort by patient, by date, task, or your clinician. You do have the capability to view just your active patients or any documents for your discharge patients. You can also export this report to Excel. And you notice above we have the case mix analysis. The percent sign will show you the gross margin calculator. If you notice the blue heart here below, that just lets you know that one of your contracted clinicians is the one who completed that document. Okay, so I will go ahead and set my date range back. So you'll notice we have an OASIS here with a $sign and a %sign. So if we click on that $sign, you'll notice it will show you your case mix. Okay, you can select the %sign and it will give you the gross margin calculator. Okay. Okay, so first we'll want to go ahead and go into an OASIS. We'll just use this one. You'll notice on the top right you have your agency's information. On the top right you also have the type of document. Okay, so we'll go ahead and go into the OASIS scrubber. So the OASIS scrubber is a scrubber that will run the OASIS through several audits, and it'll display any inconsistencies in this PDF format. Okay. You do have the capability to approve, and this will move the OASIS to the next workflow phase, which is the OASIS export. You also have return. When I select return, this will display a new text box in which I will want to enter the return reason. So maybe your diagnosis codes are incorrect. Here you can go ahead and just type okay. So once I select return, this will take the OASIS back to your clinician's scheduled task so that they can go ahead and update the diagnosis codes. It will also display a red sticky note in which it will notify her what the correction needs to be. Okay. If you choose to make the corrections yourself from the QA Center, you would simply select the Edit button below, and this will allow the QA user to make any changes if necessary. Okay. If changes are made to any patient assessment, the OASIS will need to be sent back to your clinician and be resigned. If changes do not apply to the patient assessment, then the QA user is able to approve the document. Okay. You also notice that you can view the gross margin calculator as well. Okay. You'll notice you also have an OASIS export file. This is if you would like to generate your OASIS so that you can submit it to your state. Okay, so that's how we would QA an OASIS. Next, we'll go ahead and go into the plan of care. Please note that the POC document will automatically be created from the OASIS and/or therapy evaluation once it has been signed and completed. Once the POC is created, it will go into the QA Center. Again, you'll notice on the top left, you have your agency's information. On the top right, you have the order number and the type of document, okay? Below, again, you'll notice we have the approve. So once you have QA'd your POC, you can approve or return. By selecting return, again, you will get that red text box in which you would want to enter the reason why you're returning the document. If you choose to approve your POC, this will move the POC to the next workflow phase, which is the orders to be sent. You can also print, and this will allow a PDF version of the POC to be printed. Okay, we'll go ahead and edit. If you choose to make any corrections to the POC, you have the capability to select refresh. Refresh is if any changes have been applied to the OASIS after the POC was created. Then you will want to select the refresh button so that it can pull in all of the most current data from your OASIS to display in the POC. Below to the right, you have a format and edit button. This will allow the QA user to free text any manual changes in the POC. Okay? If changes are made, then of course you would want to send this back to your clinician so it can be re-signed. Next, we'll go ahead and go into a skilled nurse visit. Okay, again, it'll display the location of your agency or which branch and the type of visit you are QAing. So from your skilled nurse visit, you have the capability to view the plan of care. So the POC for this patient will produce in a PDF format, allowing the user to view and print. Again, you have the approve, and this will move the SN note to the next workflow phase, which is the billing console. Keep in mind that all visits must be completed to bill the episode. Again, you have return, in which it will display the text box and where you would want to enter the return reason. Once you have entered the return reason, it will display a red sticky note in the clinician's schedule task. Okay. Again, you have the capability to print, in which it will also produce a PDF version of the visit note. You also have edit. This will take the QA user into the visit note, allowing any updates to be made. Okay. So this is how you would do your Q&A. So next we'll go ahead and go into a physician order. I did have one here. I do apologize. I'm just trying to get into a physician order. All right. So you'll notice again your agency that you are QAing for. You have a physician order with the order number. Okay. You'll notice that you have an edit option as well. And this will take the QA user into the order, allowing any changes to be made. If you do make changes to the order will then need to be sent back to your clinician so that it can be re-signed. Okay. You do have approve. This will move the order to the next workflow phase, which is orders to be sent. Again, you have return, in which it will display the text box for your return reason. If changes are made, then you will want to send this order back to your clinician so it can be re-signed. Okay, you also have the capability to print, in which it will produce a PDF version of the of the physician order. Okay, so this is our quality assurance center. Again, to get to the QA center, you'll want to go to the home icon, quality assurance. Okay. Next, we'll go ahead and go into the orders management. Our orders management is where users can track all of the orders within our software. So first, we'll go ahead and go to View, Orders Management. Orders pending co-signature. So orders pending co-signature is for any clinicians who might create the order, and then we have, let's just say, a director of nursing who is going to go behind this clinician, review the order, and sign it. So you'll notice we have one here. Again, you can filter by your branch. You do have a date range that will allow you to go as far as back as you may need. And you can also export this report to Excel. Okay, so then we'll go ahead and select physician order. Once you have reviewed your order, you can then hit co-sign. And you would just want to enter your signature. Again, your signature is what you sign all of your documents in within the system. So once you have entered your signature, you can either co-sign. By co-signing, it will then move your order into the QA section. If you would like for it to bypass the QA, then you can hit co-sign and approve since you have already reviewed the document. If you decide to hit co-sign and approve, again, it will bypass the QA and go into the next workflow phase, which is orders to be sent. Okay. So I'm going to go ahead and we'll go ahead and co-sign and approve. Once I have co-signed it, you'll get a green notification on the top right that your order was successfully co-signed. And you'll also notice that it has been removed from my list. Okay. So next, we'll go back into the View tab, Orders Management, and Orders to be Sent. This is where all your orders will go once they have been approved from the QA center, or if your clinicians have the capability to bypass the QA, it will then flow into this Orders to be Sent. Okay, so you'll notice the filters above. You'll notice we have a delivery method in which you can filter by the Axxess portal. This is for your physicians who are utilizing the Axxess portal. If not, then you can select by fax or mail. You'll notice that you have the capability to view the status of your patient. So to select orders that are being sent, you would want to select the checkbox on the left-hand side, and you would hit send. Okay. By selecting send, you will receive a green notification that the orders have been marked as sent to physician. Okay. So this is how you would want to mark your orders as sent to the physician. You'll notice on the right, you do have a printer icon, and this just gives you the capability to print your order then and there, so you can submit to your physician. So next we have view orders management and orders pending MD signature. So once your order has been returned from the physician, this is where you would want to go to log the dates that you've received it. Again, you have the same filters above. You can also export this report to Excel. So let's just say that we have received our physician order. You can either select the checkbox on the left-hand side and select Receive Orders. When we select Receive Orders, it will ask you, when did you receive the order and when did your physician sign the order? So here we can say we did receive it on the 19th. However, my physician probably signed it on the 17th of February. Okay, at this point, then you would hit Mark as Received. And then you will get a green notification that your order was received from the physician. Okay. Another way to mark the orders as received by instead of selecting the checkboxes, then you can go ahead and scroll to the right, and you will notice we have Receive Order underneath the Action column. Okay, we will go ahead and select Receive Order. And again, you'll notice that it'll display the text box so that you can enter the date of when you received it and when your physician signed the order. So let's just say we got it again on the 17th of February. We would want to hit Update. When we hit Update, you'll notice that the order has now been removed from the Orders Pending list. And you'll also receive a green notification that the order was marked as received. Okay. So next we'll go into the View tab again, Orders Management, and here you have your orders history. So your orders history would display all orders that you have within the system, whether it's pending MD signature, whether it has already been sent to the physician. Okay. So here in your orders history, again, you have an edit option underneath the action column. So you do have the capability to correct the date. If you notice that there is a typo or it was an incorrect date, you have the capability to update the dates here. Okay. If you are just now receiving the order, again, you can select edit and enter the dates. When you sent the order, when you received the order, and when your physician signed the order. And then you would want to select update. Once I selected update, you'll receive the green notification that it was updated. And you will also notice the dates that I have entered. Okay. So this is the orders history. Again, if you do have any additional questions, please feel free to type them in the text box below, and I will answer them at the end of the webinar. Okay, next we'll go ahead and go into the OASIS export. So to get there, you'll want to go to the Create tab, OASIS export. Okay, I do apologize about the wait time. All right. So again, you'll notice you can filter by branch, by payment source. So if you would like to view all of the payers, you have the capability to select them. In this case, we're just looking at our Medicare patients, okay? Again, you have that date range that allows you to go as far as back as you may need. And you can also export this report to Excel. Okay, so to export your OASIS, you would simply select the checkbox on the left-hand side and hit Generate OASIS File. So by selecting Generate OASIS File, you'll notice a zip file has been downloaded. At that point, you will want to go to the QTSO website, and you will need to upload this file into their portal. And you will find this file in your Downloads folder. Okay, so once you have received a validation report from the key system that your OASIS has been approved, then you can come and mark your OASIS as exported. Again, so you would only want to mark selected as exported once you have received an accepted status on your OASIS file. Once it has been marked as exported, the OASIS will then display a green check mark in the billing console that your OASIS has been exported. Okay. After you have submitted your OASIS and you receive a rejected validation report, then you will need to reopen that OASIS and make any corrections. Okay, you'll notice that we have a mark selected as completed, not exported. This icon is for any OASISes that do not require OASIS export. Okay, usually you don't have to export the OASIS if the patient is a minor. OASIS is for, let's just say, private pay. That wouldn't require an OASIS submission. So that is when you would want to use the mark completed at not exported. This does not mean that you have not exported your OASIS, okay? You notice on the right-hand side, we have a correction number. The correction number is only used whenever you are making a correction to a non-key field M00 question. For example, the diagnosis. The diagnosis is a M00 question, but it's not a key field. So maybe you have the order of your diagnosis codes are incorrect, and maybe you need to correct the primary diagnosis. You will then just reopen your OASIS, make the correction, and you will want to submit your OASIS with the 01. Depending how many times you have reopened that OASIS to make a correction to an M00, then it's depending what number you will utilize when you export that OASIS. And you can also see it gives you like a little tip on when to utilize the 01, 02, and so forth. Okay. If an OASIS assessment was rejected and needs to be retransmitted after corrections have been made, you would still use a 00. You would still use a 00 because it was rejected. So when you resubmit it with a correction, it's like if you had never sent it before and it's the first time. That is why you want to use a 00. Okay. So let's just say that you have already exported your OASIS and it was accepted. However, you notice there needs to be changes in the OASIS and you need to generate a cancel. To generate a cancel for an OASIS, you would want to go to the View tab, Exported OASIS. Okay, again, we have the same filters. And I'm just going to take my date range back. All right, here we are. So here are all of my OASIS that have been exported within this date range. So let's just say for Jose Smith, we are needing to generate the cancel. We will want to select Generate Cancel. And again, you'll notice a zip file has been downloaded and it states OASIS Inactivate. You will then want to go to the QTSO website and you're going to upload this OASIS Inactivate, in which you will find in your Downloads folder. Once you have submitted your cancellation to the state, they will send you a validation report that it was approved. Once you receive that approved validation report, then you can reopen your OASIS, make any corrections. Once it has been QA'd, completed and QA'd, again, it will go into the OASIS export, and you will want to make sure your correction number is a 00. Anytime you cancel a exported OASIS, your correction number will be 00. Okay? So this is our OASIS export. I will go ahead and show you the key fields, and you can find the key fields by going into our Help tab, Support and Training, and Help Center. Okay, once you get to the Help Center, what you can do is just type in here where it says, what can we help you with? And we will just want to put key fields. Once I enter key fields, you'll notice my first option here is OASIS tips, key and non-key fields. Okay, so whenever you are making a correction to any of these key fields here, you will require to do an OASIS cancellation. Okay, and that is where we went into View Exported OASIS. We will generate the cancel, submit it to the state, and then you will make the correction to one of these key fields. If it does not pertain to this list here, but it is a M00 question, then that is when you will use a correction number. Okay? And again, you can find the OASIS tips in our Help Center. So this will actually go ahead and conclude the Q&A OASIS export webinar. Again, please feel free to type in any questions you may have in the text box. Please feel free to also contact us at our support line, and the number is 866-795-5990. Again, the number is 866-795-5990. Thank you everyone for joining.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading Help Center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.